Chapter 17 is going to be about the later years and elderly. Now, for the elderly, we have two main goals when we're focusing on their diet, their lifestyle, and that is to do whatever is needed to slow the aging process and promote their health. So we don't want them to just live longer, we want them to have the highest quality of life during those years as well. Now, a few things that are good to include in general for these elderly, some healthy habits like eating balanced meals, regular physical activity, avoiding things that further age them, like introducing toxins into the body. This is going to include smoking, drugs, alcohol, also making sure that they decrease their stress as much as possible because the body is not able to handle stress like it used to before. Now, we mentioned a good idea is to be physically active on a regular basis, but the guidelines for older individuals is actually a little bit different. You'll notice that there is one extra category here, which is balance. For the typical adult, we didn't have a balance category, but for the elderly, it is really important because one of the things that happens as they age is that they start to lose their balance, and if they do fall, it can be something that is a lot more worrisome than if they fell when they were younger, because now their bones are a lot more frail. It could easily lead to a fracture or a bone break. So for the balance category, we are doing exercises that are specifically targeted for balance, and these are going to be 2 to 3 days a week. The rest of the recommendations for the categories are pretty much the same, except for we do have an extra row at the bottom with things that you want to watch out for, so certain cautions. So for example, for the aerobic activity, if you're breathing really hard that you can't talk, or you start feeling dizzy or chest pain, then you want to go ahead and stop the exercise. Also, for the strength training, it tells them to make sure that they are breathing out as they contract and using steady movements. This is important for anybody who's doing strength training, but it's something that's actually written out for the elderly guidelines because it's something that can cause damage very easily. Again, as you get older, your body's not working the same, their muscles are not as strong anymore, they're already losing a lot of muscle. So it's very easy for them to hurt their muscles when they're doing strength training exercise. And that's something that we want to avoid. But at the same time, we want to make sure that they are including strength training because this is something that we said helps strengthen your bones. When you put stress on your bones by doing things like weightlifting, it causes your bones to continuously remodel themselves in a way where they maintain dense bone structure. So this is something that's really good for the elderly population. Now, as for the type of diet that they want to have, this is something that they're still trying to figure out. They're trying to figure out the best way to slow the aging process. What is the best diet to slow the aging process? And what they have found in animals is that animals who are on a restricted calorie diet, which is about 70% of their normal calorie intake, they tend to have less age-related diseases, which is a result of the aging process slowing down. They also tend to live longer. Now, when we figured this out for animals, they wanted to go ahead and implement it in humans, but it's something that is a little concerning because of the fact that doing some kind of energy restriction on the elderly who are already more frail is something that could be the not the most ethical thing to do, because if it doesn't work out, then it could be something that could lead to earlier death or some other major health problems. So right now what the recommendation is to drop maybe 10%, maximum 20% of the typical energy intake, and that would come with some health benefits as well. Another thing we mentioned was to decrease stress. So this is going to be all types of stress, emotional, mental, and also physical stresses. The body's response to stress is not as well as it used to be as they get older. And with men and women, they tend to handle stress a lot differently. Women tend to be able to handle stress a lot better than men, especially in the older years. And the reason for this is because women don't tend to have as much of the fight or flight response to stress like men do. They tend to have more of the tend or befriend response to stress, which is basically taking care of other individuals as a way of dealing with stress, feeling more settled and in control, as well as talking to their friends, having a close-knit group that's a support system, whereas men tend to coop things up and not really look for help with their friends or really open up about their stresses, which makes it even harder on these individuals since their body is not capable of handling stress as well as it used to when they were younger. Now, as for the weight, even though we mentioned that restricting calories tends to show better health, when it comes to weight, it's actually the opposite. They've seen that the elderly can actually be at a higher weight and have better health than if they followed the original recommendation for weight for the typical adult. If you remember, the BMI recommendation for a healthy adult is 18.5 to 24.9. But for the elderly, they actually found the lowest rate of death or the lowest health risks in individuals who had a BMI of 23.5 to 27.5. So technically that would be considered the overweight category, and that's something that has shown to have the least health concerns. So that is what is recommended for the elderly. Now at the same time, we don't want it to go past this range because it does get to a point where we're reaching obesity and the extra weight starts putting additional stress on the bones and the body of the individual that comes with its own health problems. Now, regardless of weight, the actual composition of the body is going to be changing as they get older. And what tends to happen is with age, the muscle starts to slowly deteriorate. And so the elderly individuals end up with more fat tissue making up their body than muscle tissue. And this is something that's just a normal part of the aging process, and it is called sarcopenia. Sarcopenia is the loss of muscle tissue as individuals get older. Now, what this is showing us here in the picture are two women who had similar size thighs. So they both had thighs that had about the same diameter, but when they looked at what the thighs were made of, the younger woman, who was about 20 years old, had a lot more muscle making up her thigh, whereas the woman who was 64 years old and had the same size thigh had a lot more fat. So the fat that you see is in white, the muscle is in black. And the one that's on the left is for the 20-year-old, so just a small amount of fat lining the muscle, lining the thigh. And then the one on the right is the one for the elderly woman, and you'll see that it is primarily fat tissue. And so this is something that happens as individuals age. They might look like they are still maintaining their weight, but they are definitely going to be losing more muscle, which means that they are going to be weaker, and that also can affect their balance as well. Now, another thing that changes with age is the immune response. Normally, the way that your immune system works is when you are exposed to something foreign or you are injured in some way, you have some kind of infection, your body starts the process of inflammation, where it sends your blood cells and other cells to the site of injury or the site of infection to start healing the process. And that's when you see on the outside, you see the swelling, the redness of your skin. That indicates that there's inflammation going on. And that's a good thing when it's something that happens just for a temporary period of time. But for the elderly individuals, their immune system is not as good as fighting illnesses and infections. And so what happens is when they have something to fight, their immune system stimulates the inflammation. But since the immune system is not functioning very well, it basically keeps the inflammation process going for a prolonged period of time, which is what we call chronic inflammation. And that is something that actually becomes detrimental. Inflammation is good when it is just for a short period of time, but chronic inflammation is actually worse for your health. And we'll be talking about the results of chronic inflammation in the upcoming chapter. But just to mention a few things that individuals of the elderly population can do to help, and that is going to be primarily enhancing their immune system with a healthy diet rich in antioxidants. This is going to come from having a diet rich in fruits and vegetables primarily. There are other things that start to happen with age that will start to affect the body's ability to handle nutrients. And the first thing is how the digestive system or the GI tract is affected. Now, one thing that starts to happen is that the muscles of the intestine start to deteriorate. And remember, the muscles of the intestines are what help move things along through the process of peristalsis. And so what ends up happening is if those muscles deteriorate, they're going to have less movement of the food through the digestive system, which means they're going to suffer more from constipation. Another thing that can start happening is that the amount of hormones and acids that their body produces, the digestive hormones, digestive acids, start to actually decrease as well. And remember, hormones tell our body which enzymes are needed to be released to digest our food. And the acid in our stomach is responsible for activating some of those enzymes and preparing our protein for digestion. If the individual is not producing much acid anymore, that's what we call atrophic gastritis, and that can really prevent protein from being absorbed because protein needs the acid to denature it, and protein also needs the acid to activate the enzyme for protein digestion. So these individuals really need protein at this age to make sure that they are not losing more of the muscle mass that already happens with age. And so if they have this issue where they're not producing much acid in their stomach anymore, the rate of muscle breakdown can actually become a lot higher. One other thing is something called dysphagia, which is having trouble chewing and swallowing. This is something where the individuals have to be put on a special texture level when it comes to their food because they are unable to swallow foods that are maybe more texturized, or even some of them will even start to choke on foods that don't have much texture as well. So basically this is a situation where they need to maintain a certain consistency with their foods because they are having trouble swallowing the food without feeling like they are choking. Another thing that can influence the way that they eat is the tooth loss that also happens with age. This is something that can make it really hard to chew, especially for the more harder foods that tend to contain a lot of fiber. So things like your grains or the harder vegetables and fruits, those are usually things that the elderly will avoid because they are lacking their teeth, and it becomes difficult to chew harder textured foods. And the problem with that is they're missing out on the fiber that comes in those harder foods and also the vitamins and minerals that are found in those vegetables. A lot of them will also start to lose some of their senses in terms of taste, smell, and that can be something that can make it less appetizing to eat as well. Some psychological changes can also influence the nutrition status of the elderly, starting with depression. A lot of times, these elderly individuals have friends and family members around the same age that are starting to pass away. And so they're losing a lot of their companionship, a lot of their support, and along with that, sometimes they start to lose the basically the motivation to cook. They used to cook for example, themselves and their spouse, and now that they're on their own, they're not motivated to get up and make something just for themselves. Or some of them will lose their appetite along with the depression. We also have individuals who are just incapable of cooking when they get to this older age. Maybe they always relied on their wife to cook for them, and as they get older, they aren't really in a state of mind or even in a physical state to be able to learn to cook at this age, and their wife passes away and now they have to tend for themselves when it's not really the best time for them to be really learning how to do this. Also, some individuals might be suffering from some financial changes. This includes things like going into retirement and no longer having that steady income. Some of them will be getting disability or social security, but a lot of times that tends to just be enough to fuel their basically their bills at home, and then their medication bills, their doctor bills, and then they don't have much left over to really take care of themselves when it comes to proper healthy meals. Water is something that elderly also tend to struggle with. A lot of them tend to be dehydrated, and there's several reasons for this. Some people will avoid drinking water because they have less control of their bladder at this age, and they know that if they drink, they might have an accident. Or some of them maybe are less mobile in terms of having to use some kind of assistance to move around. Maybe they're afraid of having another fall and injuring themselves again, and so they prefer to get up as little as possible, and so they avoid drinking because they don't want to have to get up and go to the restroom. Some of them also are suffering from the dysphagia, where we said they start to have that choking feeling when they try to swallow, and so some of them will avoid drinking for that reason. And so because of all of these factors that can negatively influence their water intake, the recommendation is really just enough to prevent dehydration. So it's actually less than the recommendation for the typical adult. Normally we say 8 to 10 cups of water, but for the elderly, we want them to just get 6 glasses of water as a minimum. If they can get more, great. But if all we can shoot for is 6, then that is good enough to prevent dehydration. Now, as for what the diet needs to be made of, now their calorie needs are going to be decreased just slightly because of the fact that they're just not as mobile anymore and they're losing a lot of their muscle, and muscle uses up more calories. So their energy needs do decline slightly, but we still want to make sure that they are getting a good amount of nutrients in their diet, in particular protein. Protein is really important for these individuals because of the fact that they're already going through muscle breakdown. We want to make sure that their muscle breakdown isn't happening at any faster of a rate than it is already. And so we want to make sure they have enough high quality protein to maintain the muscle that they do have. Carbohydrates are also important, especially in the form of the more fibrous carbohydrates, because these are going to be things that are going to help move things along. as their muscles start to slow down in the digestive system. Fat is something that we don't want to increase, so we're mostly focusing on high protein and carbohydrates. Fat is going to be a more moderate level, but we just want to make sure that they are getting their omega-3 and omega-6 fatty acids. We really want to make sure that they're not getting too much fat at this age because they already have a higher risk of heart disease, and we don't want to make that worse by having a high-fat diet. Now, as for supplements, really the best recommendation is to take a multivitamin, and that should cover most bases. But there's some individuals who might need to take individual supplements as well. For example, if they're really suffering from bone loss, a doctor might recommend taking a calcium supplement that comes along with vitamin D as well to ensure absorption. And then people who have that atrophic gastritis that we talked about, where their stomach is not making enough HCl, it's not making that acid. We talked about one of the things that could happen, which we said is affecting the way that protein can be digested and absorbed. But if you remember, that HCl, the stomach acid, is also important for the absorption of B12. We need the acid to break off the initial protein so that B12 can attach to the intrinsic factor and be absorbed. So for individuals who have atrophic gastritis, they're going to not only suffer from lack of protein absorption, but also lack of B12 absorption. So they might need to consume a special B12 supplement that doesn't require the HCl for its absorption. Now, there are some individuals who, despite all of these attempts, are still in the malnourished category of elderly, and there are certain things that the government has put into place to try to minimize this as much as possible. For example, we have something called the Nutrition Screening Initiative, which is something that they're trying to get all doctors to do when an elderly comes in for a visit, even if it has nothing to do with their nutrition, to go ahead and ask certain questions that screen for malnutrition so that we can make sure to catch it early on if there is an issue there. There are also certain food assistance programs from the government. For example, we have certain nutrition programs that provide group meals. Basically, they'll have a public setting where the elderly can come together and eat a meal that's provided to them. And this is something that can be really helpful for individuals that are suffering from the depression, from losing their companions and their support system. Here they are able to come out and socialize, and that tends to open up their appetite more so that they are more willing to eat. For individuals who aren't as capable of getting around, we also have the Meals on Wheels program that delivers healthy meals to the elderly who aren't as mobile. Now let's go ahead and take a look at some of the age-related illnesses that these elderly can experience. The first and most common one is affecting the vision. This could be just the deterioration of vision gradually, which we call macular degeneration, or it could be in the form of cataracts. Cataracts are actually very common with age, and it's when the lens starts to cloud over. They actually need to surgically remove the lens and put in an artificial one to get rid of that cloudiness. Otherwise, they're not going to be able to maintain their vision for much longer. Now, this over here is showing us the basically the result of cataracts. So you see in the picture on the left, the light is able to come in very strongly and hit the retina. But with the one on the right-hand side of that picture where it says cataract lens, the lens is actually very clouded. So when the light tries to pass through the cornea and hit the retina, by the time it gets to that clouded lens, the amount of light decreases a lot. And that leads to the blurry vision that you see on the picture in the right. Arthritis is another very common condition in the elderly. We have two main types of arthritis, the rheumatoid arthritis and osteoarthritis. Usually what is happening is in between our joints, we have cartilage that kind of acts like a cushion, lubrication, so that your joints aren't grinding against each other. Now, with people who are in the elderly population, a lot of them tend to suffer from deterioration of that cartilage. So basically, they don't have much cushion between their joints anymore, and they're getting a lot of pain because their joints are grinding, the bones in the joints are grinding against each other. This can be made even worse if they are overweight or obese, because they're putting further stress on their bones, which further stresses the cartilage in between the joints. Now with rheumatoid arthritis, it's basically the same thing, except this is more of a genetic condition where the immune system views the cartilage as something that's bad for you. So it's kind of like an autoimmune disease where the immune system starts to attack the cartilage and causes it to deteriorate early on. Another common concern in the elderly is the deterioration of the brain. And one of the common ones is dementia. This is going to be a situation basically where the neurons in the brain start to deteriorate. It can have to do with the environment, diet, lifestyle, but a lot of it is genetic as well. We also have Alzheimer's disease, which is also something that is very common and tends to be more genetic as well. Now, what tends to happen is basically the body starts to develop these plaques on the nerve cells. And what that does is it prevents the blood from flowing to the nerve cells and depositing nutrients there. So the nerve cells basically start to die off. Now, when it comes to how we treat this, they haven't really found a cure for Alzheimer's, but there are certain medications that can help basically slow it down as much as possible, as well as having a healthy diet that is rich in antioxidants as well can help basically maintain the brain functionality for as long as possible. Now this over here is showing us a picture of what happens. So you basically have these nerve cells that start developing plaques, and these plaques get in the way of the nutrients reaching the cells, and when they don't receive their nutrients, the cells actually die off. So you see in the picture there, you have a healthy brain and a brain with Alzheimer's. The brain with Alzheimer's is a lot smaller now because as the nerve cells die, the brain actually shrinks and starts to lose the ability to function in terms of memory, ability to think, plan, and so on.